When death becomes a doorway instead of an ending, everything we know about consciousness gets rewritten. What you're about to witness is the most documented case of clinical death and supernatural return in medical history. This isn't just a near-death experience. This is proof that some journeys transcend the boundaries of human understanding and challenge everything science believes about life, death, and what lies beyond. Subscribe now for more incredible stories that challenge our understanding of human possibility. These experiences will change how you think about consciousness, death, and the mysteries that exist beyond medical explanation. What happens when someone dies for over 4 minutes and returns with impossible knowledge that defies medical science? On October 23, 1982, Sammy Davis Jr. crossed the ultimate boundary and came back with revelations that forced doctors to question everything they thought they knew about consciousness, death, and human capability. The 4 minutes and 17 seconds that followed would rewrite medical understanding forever. This is the extraordinary true story of the most documented afterlife experience in history. October 23, 1982. Cedars-Sinai Hospital in Los Angeles was preparing for what should have been routine throat surgery on Sammy Davis Jr., who at 57 was still performing regularly despite ongoing health challenges that had accumulated over decades of intensive entertainment career demands. The procedure was scheduled to address chronic throat problems that had been affecting Sammy's singing voice, with Dr. Michael Chen, one of California's most respected ENT surgeons, leading a team of specialists in what was considered a low-risk operation with excellent prognosis for full recovery. Sammy was in good spirits before surgery, recalled anesthesiologist Dr. Patricia Williams. He was joking with the staff, discussing his upcoming performance schedule and showing no signs of the anxiety that sometimes complicates surgical procedures. At 57, Sammy remained one of entertainment's most vital performers, but the decades of cigarette smoking, stress, and intensive performing schedule had taken a toll on his cardiovascular system in ways that wouldn't become apparent until the surgical crisis that followed. The operation began at 2:15 p.m. with standard anesthetic protocols and normal vital sign monitoring. For the first hour, everything proceeded exactly as planned, with Dr. Chen successfully addressing the throat issues while Sammy's vital signs remained stable and strong. But at 3:22 p.m., something went catastrophically wrong in ways that challenged every assumption the surgical team had about routine medical procedures and predictable patient responses. Sammy's heart rate began fluctuating in patterns we'd never seen before, recalled Dr. Williams, who was monitoring anesthetic levels and cardiovascular function. It wasn't gradual deterioration. It was sudden, dramatic changes that seemed to come from nowhere. Within 90 seconds, Sammy's cardiovascular system was in complete crisis. His heart rate became erratic, his blood pressure dropped precipitously, and his oxygen saturation levels began falling despite optimal ventilation support. Dr. Chen immediately shifted into emergency protocols, calling for additional cardiac specialists while attempting to stabilize Sammy's condition through standard resuscitation procedures that should have been effective for the type of crisis they were observing. But nothing worked. At 3:27 p.m., Sammy's heart stopped completely. The EKG monitor showed the flat line that every medical professional fears: complete cardiac arrest with no electrical activity, indicating any possibility of spontaneous recovery. "We had complete cardiac flatline," recalled Dr. Chen, whose detailed documentation of the incident would later become required reading in medical schools worldwide. No heartbeat, no brainwave activity, no response to standard resuscitation protocols. By every medical definition, Sammy Davis Jr. was dead. The next 4 minutes and 17 seconds would challenge fundamental assumptions about consciousness, death, and what constituted the boundaries of human experience. Dr. Chen and his team applied every resuscitation technique in their considerable arsenal: cardiac massage, electrical defibrillation, emergency medications designed to restart heart function, and advanced life support protocols that represented the pinnacle of 1982 medical technology. Nothing produced any response. The monitors continued showing complete absence of cardiac activity, respiratory function, and brainwave patterns that indicated any possibility of consciousness or survival. After 3 minutes of flatline, we were facing the reality that resuscitation was becoming medically impossible. Dr. Chen later documented. But something made us continue beyond normal protocols. Something about Sammy's case felt different in ways we couldn't explain. The medical team continued resuscitation efforts for exactly 4 minutes and 17 seconds of complete clinical death, longer than standard protocols recommended, and far longer than most patients could survive with any possibility of neurological recovery. At 3 hours 31 minutes and 17 seconds p.m., something impossible happened. Sammy's heart suddenly resumed beating with strong, regular rhythm. His brain waves immediately returned to normal patterns. His breathing resumed naturally without mechanical assistance. All vital signs stabilized instantly to normal ranges that indicated not just survival, but complete physiological recovery. It wasn't gradual return. It was instantaneous restoration of all functions, recalled Dr. Williams. In 30 years of anesthesiology, I'd never seen anything like it. Patients don't just come back from 4-minute cardiac death with normal brain function. But the medical impossibility was just the beginning of what would become the most documented and verified supernatural experience in hospital history. When Sammy regained consciousness, his first words were not the confused questions typical of patients recovering from cardiac arrest, but specific, detailed information that he couldn't possibly have known through any normal means. "Frank is here," Sammy said clearly, and immediately upon awakening. "He says to tell you that the patient in room 412 is going to be fine, but the woman in 318 needs different medication because what you're giving her isn't working." The surgical team was stunned. Frank Sinatra had died 5 years earlier, and there was no way Sammy could have any current information about other patients in the hospital, since he had been unconscious under anesthesia for over 2 hours. Dr. Chen immediately sent nurses to check on the patients Sammy had mentioned. In room 412, they found a cardiac patient whose condition had been uncertain, but was indeed stabilizing exactly as Sammy had predicted. In room 318, they discovered a woman whose medication was failing to control her condition in ways that matched Sammy's specific description. That was just the beginning, Dr. Chen recalled. What Sammy told us over the next hour challenged everything we thought we knew about consciousness, medical knowledge, and what was possible during clinical death. As Sammy fully regained awareness, he began sharing details about his experience during the 4 minutes and 17 seconds of clinical death that defied medical explanation and verifiable documentation. "I wasn't unconscious," Sammy explained to the medical team. "I was more conscious than I'd ever been in my life. I could see everything, not just this room, but the entire hospital, other patients, things happening in places I'd never been." He described in perfect detail the emergency procedures that had been performed on his body while he was clinically dead, despite having no brain activity that could have registered those experiences. More remarkably, he provided accurate information about medical situations throughout Cedars-Sinai that he had no normal way of knowing, including patient conditions, staff conversations, and treatment decisions being made in completely different areas of the hospital. Sammy told us about a child in the pediatric ward who was going to have complications with her surgery scheduled for the next day, remembered Dr. Williams. He described specific medical details about her condition that only her surgical team knew. When we checked, everything he said was accurate. But the most profound aspect of Sammy's experience was his encounter with deceased individuals who provided him with verifiable information that challenged basic assumptions about death, consciousness, and the continuation of identity beyond physical life. "My father was there," Sammy told the assembled medical team. "He told me things about my childhood that I had never shared with anyone, private conversations we'd had when I was 5 years old that only he and I could have known." Sammy's father had died when Sammy was a young child, but the information Sammy shared was later verified through family records and relatives who confirmed the accuracy of details that had never been publicly discussed or documented. "Frank was there too," Sammy continued. referring to Frank Sinatra. He said it wasn't my time yet, but that I needed to tell people about what death really is, that it's not ending, it's transformation into something more conscious, not less. According to Sammy's account, his encounter with Frank Sinatra during clinical death included specific messages for mutual friends, references to private conversations they'd had before Frank's death, and predictions about future events that would later prove accurate. But the most medically significant aspect of Sammy's experience was the knowledge he gained about medical conditions and treatments that exceeded his previous education or experience. During those 4 minutes, I understood things about the human body and healing that I'd never studied, Sammy explained. I could see how diseases developed, what treatments would work, even what was wrong with people just by looking at them. Dr. Chen decided to test this claim by asking Sammy to assess other patients in the hospital. The results were remarkable and medically inexplicable. Sammy accurately diagnosed conditions in patients he'd never met, recommended treatment modifications that proved correct, and identified medical issues that our own tests hadn't yet revealed. Dr. Chen documented, his accuracy rate was nearly 100%, which is impossible for someone without medical training. The hospital's chief of staff, Dr. Robert Michaels, called in additional specialists to evaluate Sammy's claims and test his apparent acquisition of impossible medical knowledge. We presented Sammy with case studies, patient files with identifying information removed, and complex medical scenarios, Dr. Michaels recalled. His diagnostic accuracy and treatment recommendations consistently exceeded what we would expect from experienced physicians. The medical team also documented Sammy's ability to predict patient outcomes with impossible accuracy, including recovery timelines, treatment complications, and even which patients would not survive despite aggressive medical intervention. He told us that Mrs. Anderson in the cardiac unit would recover completely and be discharged on Thursday, even though her prognosis was poor, remembered Dr. Williams. He also said that Mr. Garcia wouldn't survive the night, despite his stable condition. Both predictions proved accurate, but perhaps the most profound aspect of Sammy's experience was his description of consciousness during clinical death as exponentially more aware, not less, than normal human consciousness. Death isn't unconsciousness, Sammy explained. It's superconsciousness. I could perceive everything simultaneously. Past, present, future, other people's thoughts, the interconnection of all life. It was like being upgraded from black and white television to color, then to high definition, then to something beyond any technology. Dr. Chen's documentation of Sammy's case became the subject of intensive medical research and was published in multiple peer-reviewed journals as evidence that consciousness might not be generated by brain activity, but merely transmitted through it. The implications of Sammy's experience challenged fundamental medical assumptions about the relationship between consciousness and brain function. Dr. Chen wrote in the New England Journal of Medicine, "If consciousness can exist and even expand during complete brain death, we need to reconsider everything we think we know about human awareness and survival." The case also attracted attention from researchers studying near-death experiences, who found Sammy's account unique in its medical documentation, verifiable accuracy, and the complexity of information he acquired during clinical death. Most near-death experiences involve subjective spiritual encounters that can't be verified, explained Dr. Raymond Moody, a leading researcher in the field. Sammy's case provided objective, verifiable evidence that consciousness continued and expanded during clinical death in ways that suggest survival of identity beyond physical brain function. The experience profoundly changed Sammy's approach to life and performance, leading him to incorporate spiritual themes into his entertainment work and to speak publicly about consciousness, death, and human potential. "That experience taught me that we're not just physical bodies with temporary consciousness," Sammy explained in later interviews. "We're eternal consciousness temporarily using physical bodies. Death is just changing costumes between performances." For the medical team at Cedars-Sinai, Sammy's case became a watershed moment that influenced their approach to patient care, end-of-life treatment, and understanding of consciousness during medical emergencies. Sammy's case taught us that there are aspects of human consciousness that exceed current medical understanding, Dr. Chen reflected years later. It made us more humble about the limitations of medical knowledge and more open to possibilities we hadn't previously considered. The detailed documentation of Sammy's clinical death and impossible return became required reading in medical ethics courses, consciousness research programs, and near-death experience studies at universities worldwide. Most importantly, Sammy's experience provided hope and comfort to countless people facing their own mortality or the loss of loved ones, offering evidence that consciousness continues beyond physical death in ways that exceeded rather than diminished human capability and awareness. Sammy came back from death with proof that life continues. Dr. Williams observed, not just survival, but expanded life, enhanced consciousness, and continued connection with everything and everyone we love. The 4 minutes and 17 seconds of clinical death had lasted less than 5 minutes, but the evidence Sammy brought back would influence medical understanding, consciousness research, and human hope about survival beyond physical death for decades to come. Years later, when Sammy actually died in 1990, the medical team that had witnessed his 1982 resurrection reported feeling less sadness than usual because they had evidence that death was transformation rather than termination, and that Sammy's consciousness would continue in expanded form rather than simply ending. "We knew we weren't really losing Sammy," Dr. Chen said at Sammy's 1990 funeral. "We were just saying goodbye to the physical form of someone whose consciousness we knew continued beyond death, because he had shown us proof that life transcends the boundaries of the body."